Welcome everyone to this presentation. We're going to be covering healthcare provider roles and responsibilities in the Texas Workers' Compensation System. So last time you adeptly navigated the log run, carefully crossing the obstacle course, that obstacle, and learning how to become a Texas workers' compensation healthcare provider. So today we are grabbing onto the ring swing. Each ring represents a critical element of the workers' compensation uh, participation by healthcare providers. So first, how to participate. As you swing to the second ring, I want you to know your different workers' compensation doctor roles. And then you're going to reach for the third swing and the third ring and know your responsibilities. So by the end of this boot camp session, we want you to have the grip strength, swing confidently through the workers' comp system. It's going to keep your patients moving forward, supporting employers with the knowledge that they need about their employee, and all the while protecting you and your practice from a costly plunge. So, healthcare provider roles and responsibilities. Just a disclaimer before we get started into the content. Our main goal is to provide you with information. This presentation is current and updated as of today, March 3rd. It's for educational purposes only, and it is important to remember the responsibility of knowing and following the rules and statutes lies with you. If there's ever a dispute or a complaint, it's going to be resolved based on the rules and the statute and not necessarily what was presented here today. So we're going to be going over first some important definitions related to healthcare providers, roles and responsibilities, then get into the basic qualifications of the healthcare providers, and then more more into the doctor's roles, and then general responsibilities of all of our healthcare providers, and then the responsibilities of our doctors. Now, for healthcare provider requirements. So something you might notice, we go over these definitions of a healthcare provider, is that some of the meanings of the terms uh, may slightly differ just a little bit based on what you've heard, but the term care provider and workers' compensation is going to refer to both individuals and facilities. So specifically, a healthcare facility includes hospitals, emergency clinics, outpatient clinics, and other facilities that are going to provide care. So that's a healthcare facility. And then the term healthcare practitioner in workers' compensation includes not just licensed individuals providing, but also non-licensed individuals who work under a doctor's supervision. So this distinction, it shows how the language workers' compensation kind of flows for those role those healthcare providers. And these definitions are lined out in section 401.011 of the Texas Labor Code. And basic requirements to participate in workers' compensation in Texas, healthcare practitioners meet some of the basic requirements. First, you must have an active medical license in your jurisdiction. So if you're practicing in Texas, you need to be licensed in Texas. If you are unlicensed, you still participate, but only under the supervision of a licensed healthcare provider. So in Texas, practitioners to file financial disclosure with the Division of Workers' Compensation. Also, our doctors, you can't have any disciplinary orders that would restrict your ability to work within the system. So these requirements are going to help ensure that our practitioners are qualified as well as being compliant with system standards. The financial disclosure. This is all about ensuring transparency. We want to prevent healthcare practitioners from making unnecessary referrals to providers that they have a financial interest in. So this is going to help ensure that any referrals to associated entities, they're going to be appropriate and ethical. So financial disclosure, it's going to also apply to compensation arrangements that you have. So this is going to include any payment arrangements between a healthcare practitioner and their immediate family, or immediate family and a healthcare provider. So practitioners need to file financial disclosure with the DWC if they refer an injured employee to a provider that they have a financial interest in. And this needs to be done within 30 days of that first referral, of that initial referral to that person, unless it was already disclosed. So if you're looking for more details, we have a web page with examples and instructions, how to file financial disclosure information in our tax comp system online. And you can find this, if you look at the map that was sent out with your login information, you can find it under F for financial disclosure. That has that map has the workers' compensation A through Z section. That link that you can find, it'll take you to our division website, that workers' compensation A through Z. So examples of disciplinary action. The DWC, the division, we're responsible for regulating and overseeing the workers' compensation system, making sure that everyone, including healthcare providers, comply with our regulations. So if any non-compliance is discovered, the division come in and impose penalties. These could include restricting providers from treating workers' compensation patients. So, there's a list of healthcare providers with restrictions that's available on the division's website. You can find that in that A through Z workers' compensation A through Z section, and then go under D for doctors not treating. And while these providers, they may still be able to practice, the restrictions might limit certain services that they can provide. One of the most important roles that we have in the workers' compensation system for our providers is serving as a designated doctor. So an example is that that um, that doctor may, one of the penalties might be not being able to serve as a designated doctor, so they can't get that special training and perform the exams to help resolve disputes in our system. Also, way back in the day, you may remember hearing about the approved doctors list. So it no longer exists. However, the doctors that were on that were denied from that approved doctor list are still not able to participate in the workers' compensation system unless the commissioner says otherwise. So those are still in place, but again, there's actively not an approved doctor's list. So let's dig into the specifics of each doctor's role. And first, we have our treating doctors. This is a primary physician that's coordinating care for the compensable injury. So you can think of this as the gatekeeper for the injured employee's treatment. Generally, this is going to be the first doctor to provide care to that injured employee. So there may be some exceptions, but we'll cover that a little bit later. Next, we have our referral doctor, and then they're the provider that's going to step in to examine or treat the employee at the treating doctor's request. So we might also have a consulting doctor, and the consulting doctor, they're going to examine the injured employee or review their records at the request of the treating doctor or a designated doctor or even the division. And next, have our designated doctors. They are assigned and trained by the division to resolve disputes around maximum medical improvement, whether or not the injured employee has an impairment rating, whether or not that person is able to return to work. So they can be requested by insurance carrier, the injured employee, or even the division, the commissioner. So they may handle any of those types of disputes. And next, we have our required medical exam doctors. And these are doctors who evaluate the injured employee's condition at the request of, most often it's at the request of the carrier. It could also be at the request of the division. Most often, this is to weigh in on whether maximum medical improvement or impairment ratings are, if they're in agreement with that after a designated doctor has already examined the injured employee. And then finally, the peer or utilization review doctor, they're going to conduct an administrative review of the medical records. So there's no physical exam involved in this. And again, most often these are done at the request of the carrier. Uh, these these practitioners must have no conflict of interest with the injured employee or the treating doctor. So, according to the Texas Labor Code, a doctor is defined as a licensed, authorized doctor of medicine, osteopathic medicine, optometry, dentistry, podiatry, or chiropractic. To practice in Texas, they must hold a valid Texas medical license. So, other practitioners, like physician assistants or nurse practitioners, they can treat injured employees, but they're not meeting that legal definition of a doctor under the Texas statute. And they cannot be officially assigned as the treating doctor for that injured employee. Many healthcare systems don't recognize chiropractors as doctors, but in Texas, we do. The Texas Labor Code does. So chiropractors are fully recognized as doctors within the workers' compensation system. They can serve as treating doctors. So we've defined what each doctor role is. Now let's dive into the responsibilities each of these providers have. That's outlined in the Texas Administrative Code, Rule 180.22. So responsibilities of all healthcare providers in the Texas workers' compensation system must adhere to our rules, our statutes, our policies that guide the system while providing that high quality medical treatment that we expect in Texas. And this includes things like reporting required information, disclosing financial interest, and providing fair, unbiased evaluations of injured employees' conditions. So their medical opinions are vital to ensuring injured employees get the care that they need when they need it. Providers are also expected to evaluate each case impartially, so that means without bias, as well as use treatment guidelines that are required in our rules, and have honest, important conversations with the injured employee about their care. Talk to them about returning to work, setting expectations for recovering from the injury that they sustained, and most importantly, helping them make that decision to return to work when it's medically appropriate. And all of this is to maintain the integrity of our system, the effectiveness of our system. Healthcare providers also need to make sure that they're billing correctly by following the medical billing and fee guidelines. Those are outlined in Chapter 134 of our rules. And one key task for healthcare providers is to examine injured employees to determine when they've reached maximum medical improvement. The maximum medical improvement means that the injured employee is as good as they're going to get from the injury. That means they've reached maximum recovery from their injury. For some employees, this means a full recovery, right? They're back to 100%, but others may not get back to 100% of their pre-injury status. So usually claims have this date, this milestone of maximum medical improvement documented. And if there's any lasting damage or harm to the person's body, then an impairment rating can be assessed. If it's a minor injury, they may not have that documented. But if there is an impairment rating, the impairment rating, that's going to be a percentage that reflects the permanent impairment of the whole body that resulted from that injury. Healthcare providers also need to comply with federal regulations like the Americans with Disabilities Act to ensure that they're meeting legal requirements while providing the best possible care for our injured employees. So, responsibilities of treating, referral, and consulting doctors, these all center around providing the care that's simply necessary to treat work-related injuries. So this means their job is to ensure that the treatment cures or relieves the effects of the injury, that it promotes the injured employee's recovery, it enhances their ability to return to work in a productive role. It make that helps them make that decision to return to work. So injured employees are entitled to all necessary health care for the duration of their claim. There's not technically a cutoff for medical services even after the employee reaches maximum medical improvement, but again, to be reasonably necessary. So now that we have gone over the general responsibilities of providers, let's focus on the role of the treating doctor. We'll take a closer look at their specific responsibilities within the Texas workers' compensation system, and then what sets their role apart from the others. So, choices of treating doctors, choice of treating doctors, the injured employee has the right to choose their treating doctor. So usually, again, it's going to be the first doctor that provides care to this person becomes their treating doctor. For network claims, injured employees must select from the network panel of contracted doctors, and those panels may or may not include chiropractors. So if you want more information about the process of choosing a treating doctor, it'll be in the Texas Administrative Code 126.9. And there are some exceptions to an injured employee's choice of treating doctor. The first one, if a doctor is paid by the employer or if they were recommended by the carrier or the employer, this may affect their choice. However, if the injured employee receives treatment from a recommended doctor for more than 60 days, that doctor can become their treating doctor. Another exception involves emergency room doctors. An emergency room doctor does not automatically become the treating doctor unless the injured employee continues to receive care from them beyond the follow-up treatment related to emergency room visit. So if the injured employee wants to change their treating doctor, if they want to switch to a new treating doctor and they find a doctor who's willing to serve as their treating doctor, they can request a change. And this would be done using that form DWC form 053, the 53 form. And this form has to be signed by the new doctor saying that they will take on this injured employee and then submitted to the DWC for approval. So the form can be sent to us in several ways. It could be uploaded into TextComp. We learned about that system last time. It could be faxed, it could be mailed. So once we receive it, the request is reviewed, processed within 10 days. And then if it's on a network claim, networks, political subdivisions, that would be things like counties, sheriff's offices, school districts. They may contract with healthcare or healthcare providers or operate like a network. So you want to be sure and check with them directly to see if they have their own processes or their own form for requesting a change of treating doctor, because the division is not involved in that. So treating doctor responsibilities. The treating doctor It's responsible for overseeing the overall care of the injured employee. Again, they're the gatekeeper, even if there's other doctors involved. If the treating doctor refers the injured employee to a referral doctor, the referral doctor should be back to the treating doctor on a regular basis, keeping them in the loop about what's going on. The only exception to this is in emergency situations. The treating doctor should be approving or recommending all healthcare. Again, everything ultimately goes back to the treating doctor to ensure that they're aware of all of the treatments and they can properly coordinate the overall care for the injured employee's compensable injury. And treating doctor responsibilities, uh, another one, the employees or carriers obviously should not be directing medical care or requesting medical records. But when it comes to information about returning to work, modified duty, the treating doctor has an extremely important role. It's your duty to be talking to the injured employee and their employer about them getting back to work as soon as it's medically appropriate. We have a lot of urgency around this because there's a 50% chance of them going back to work at all, whether it's for the same employer or any employer, if they're off for more than 6 months for an injury. So this is in research. So again, returning to work is really important in mitigating the financial as well as the emotional and social cost to this, to not only the injured employee, but also the employer. So the treating doctor is responsible for completing the DWC 73 form, known as the work status report. So this is the important communication tool for that employer. So you can bill for this CPT code 99080-73 and receive reimbursement of $15, while a physician assistant or APRNs can complete the form under proper delegation. Remember, the treating doctor, they're still the one who is ultimately responsible for the form's accuracy. The requirement for the 73 form is detailed in Rule 129.5, and it's important to note that the work status report is not required for every visit. So if you're writing one, billing for one for every visit, you're not necessarily going to get reimbursed. So it's all required by Rule 129.5. The requirements are in there. Also, I recently got a call about this, that, that a doctor was in the form and not really putting in the specifics. So kind of leaving it open to a lot of interpretation, and that put them in a really dangerous position. So I don't think they're going to be doing that anymore. So we get a lot of good calls on Comp Connection, and hopefully that doctor understands Rule 129.5 and what they should be putting on that form. Okay, so next, the work status report. First, it's needed during the initial examination by the treating doctor or by the referral doctor. It's not necessary for emergency room visits. But once the injured employee visits a non-emergency room treating doctor or a delegated physician assistant or a delegated nurse practitioner, the work status report form must be completed and is required for that first visit. After that, a new report, it only needs to be submitted if there's a change in the injured employee's work status, or if their activity restrictions that they had, if those significantly change. So those are the only, you need to file another one. And then the rule also states that the treating doctor will be required to complete the work status report at the request of the insurance carrier or its agent, or if the employer requests it. But the employer can request it through the carrier. So that would be another situation. However, it should not exceed more than one work status report every 2 weeks, and it needs to be based on the doctor's scheduled appointments with the injured employee. And then next, the report of medical evaluation, or the DWC 69. This is another important form in the workers' compensation system, and this is going to document that maximum medical improvement milestone in the claim. And it's not used as often as that DWC 73 form, but it is extremely important. So you're going to use this when the treating doctor, and please let it be the treating doctor who submits this first. We definitely encourage the person that knows all about this case, all about the injured employee's condition, to do this. Um, so when the treating doctor needs to determine that maximal medical improvement date, that MMI date for an injured employee, unlike the 73, there's no separate charge or reimbursement for completing this form. When MMI and an impairment rating are required, the treating doctor completes the form. Now, there are situations where the treating doctor may not be authorized to assign an impairment rating. So in those cases, the treating doctor, they need to first determine if the injured employee has any potential for permanent impairment. And if so, that treating doctor needs to decide if they're qualified to assess the impairment rating, or they may need to refer the injured employee to a doctor who is qualified and who can assess that impairment. So the Texas Administrative Code Rule 130.2 has the guidelines for that process. Ultimately, again, it's the treating doctor's responsibility to establish whether the injured employee has reached MMI and then determine the next steps, either about their impairment rating or whether or not they need a referral to ensure that that injured employee receives that high quality, comprehensive care all the way throughout their recovery from that compensable injury. So if the treating doctor determines that the injured employee has no potential for impairment, they can certify maximum medical improvement without special training. And they would complete the DWC Form 69 with the maximum medical improvement date information. So a lot of times, workers' compensation claims involve minor injuries. So the injured employee might be treated, released. They're not receiving any temporary income benefits because they haven't lost time from work. The treating doctor isn't obligated to schedule a maximum medical improvement examination. So in these cases, the DWC 69 might not be necessary, but if an examination for MMI is conducted, the 69 form should still be completed to meet those submission deadlines. And instructions for this process are included on the second page of that form. Anytime you have a division form, if you look on the second page, it should have all the instructions, filing information for you. And then also something really great, as of June 1st, 2025, these maximum medical exams where there's no permanent impairment, where there is not the possibility, no possibility of permanent impairment, those may be done by telemedicine or telehealth. So however, if you still don't want to conduct an MMI exam, if an insurance carrier requests the 69 to certify even for a minor injury, that MMI date, the treating doctor, you could just send the insurance carrier the last clinical notes that you have, the completed work status report for that injured employee, and you're not required to schedule or conduct an MMI exam. So no matter which route you go, right, clinical documentation is important, and it should be detailed regarding the mechanism of injury from the very first visit, right? Document that mechanism of injury along with their history, exam, any additional findings all the way through that claim. So remember, once an injured employee has been evaluated and reached maximum medical improvement, they could potentially still receive any medically necessary medical benefits for the life of their claim. So it's not just a line drawn in the sand that no, they can't still receive care. So when another doctor assigns an impairment rating or certifies maximum medical improvement, they are required to send that 69 form and any related reports to the treating doctor for review. Again, hopefully the treating doctor has already done this, but if someone does not agree, they would go to that next person. But anyone else that does these exams, they're required to send that 69 form, any reports to the treating doctor. The treating doctor is not obligated to conduct a separate examination of the injured employee to confirm MMI or the impairment rating. So instead, they should use what they know and what they understand about that injured employee's condition to make it an informed decision of whether or not they agree with it. So if the treating doctor disagrees with the other doctor's assessment, they must provide a detailed explanation for their reasoning to both the division and the injured employee within 7 days of receiving that report of medical evaluation form. So again, we're trying to keep transparency and clarity in the evaluation process. So next, treating doctor, if there's a dispute and a designated doctor is requested to give their opinion about the date that this person was at maximum medical improvement, if they had an impairment rating, or any other of those other issues related to the injured employee's compensable injury, treating doctor, you have an extremely important role to play. So treating doctor, you're responsible for sending all of the relevant medical records to the designated doctor to ensure that they have everything that they need for a thorough evaluation. So in workers' compensation cases, this can be done without a signed release from the injured employee. These cases are generally exempt from HIPAA compliance. So the designated doctor is authorized by our rules, by our law, to receive confidential medical records to help resolve these disputes. So along with the records, the treating doctor, you can include an analysis of the injured employee's medical condition, their functional abilities, any potential return to work options. And this information, it's going to help provide an overview. It's going to aid that designated doctor in their assessment because you're the one that's been with this person that knows all about their claim and hopefully has documented it in the record. So treating doctor and insurance carrier, it's extremely important for them to ensure that the designated doctor receives the required records, any analysis, no later than 3 working days before the date of that designated doctor examination. So this could be an administrative violation if they do not timely provide those records to that designated doctor. And also it could just cause the exam to be scheduled. It's going to cause problems for the injured employee, the doctor's schedule, everything like that. Something to keep in mind. Again, the treating doctor should ensure that that the designated doctor receives the medical records no later than 3 days prior to the date of that designated doctor exam. And then that's in Rule 127.10, that 3-day requirement. The treating doctor may bill and be reimbursed for those records from the carrier. And you can find more on that, the billing and reimbursement, under Rule 134.120. So that's reimbursement of medical documentation. So, of course, there can be differing opinions about whether an injured employee has reached maximum medical improvement and what their impairment rating should be. And in some cases, the carrier might request a designated doctor exam for the injured employee to help resolve these questions. When the treating doctor has not conducted MMI or an IR exam. So if the injured employee disagrees with the designated doctor's findings, they have the right to seek an alternate certification. And this is an option in the instance where again, that designated doctor's opinion is the first evaluation of MMI and IR, and the injured employee, they're not satisfied with those findings. So the injured employee can then turn around and request an evaluation by their treating doctor or uh, a referral doctor chosen by the treating doctor. So this process gives the injured employee a chance to get a second opinion and ensure that there's fairness and accuracy in assessing their medical condition and the impairment rating. The treating doctor, it can also offer an alternate opinion on various other issues, such as the extent of injury or, again, the employee's readiness to return to work. So the criteria for this alternate opinion happens to be the same. So if the treating doctor or the referral doctor has not previously given an opinion on the matter, but the designated doctor has, and the injured employee disagrees with the designated doctor's findings, then an alternate opinion can be sought. This ensures that the injured employee, they have multiple avenues for fair evaluations, right? They're not just stuck with that first opinion or examination findings. So promoting balanced approach to their care and recovery from that compensable injury. And then the Texas Labor Code 408.0041 covers the procedures and regulations for designated doctor examinations, if you would like some additional reading on that. So causation analysis, treating doctors, sometimes when there's a dispute about whether the accident or the incident at the workplace caused that injury or the condition, the treating doctor may be asked to provide an opinion on causation. So causation is a medical opinion that's going to outline how and why the claimed accident or incident significantly contributed to the diagnosed condition that's being treated. So for this payable, compensable injury. And a thorough causation analysis should include a brief summary of the examining doctor's qualifications, the injured employee's medical history, exam findings, an explanation of how these findings led to the doctor's conclusion. And we have more detailed information on our website about causation analysis. So again, you could go to the workers' compensation A through Z section. And under there, you'll see to find causation analysis, sorry, we do have comprehensive resources on this topic. And there's also an actual example and specific information that treating doctors can reference on how to write one of these. So treating doctors, please have medical documentation. And from that very first visit, explaining the causation or the mechanism of injury so that if necessary, the medical record can resolve any of the disputes regarding the issue. If the documentation is detailed from that first visit, you may not have to write one of these additional analyses. And also, treating doctor, you could prevent a lot of disputes from arising. And let's see here. Let's discuss the other types of doctors. So we covered the treating doctor. They have very big responsibilities. Next is our referral doctor responsibilities. These are our specialists who examine and treat injured employees at the request of the treating doctor. So it's important for the treating doctor to maintain open communication with that referral doctor. So coordinated, comprehensive care for the injured employee is the goal. So open communication with all of the doctors in the process. Referral doctors, They play a vital role because they're going to be supplementing the treating doctor's treatment plan. So again, they should be providing timely, regular updates to the treating doctor. Because again, that treating doctor is ultimately responsible for overseeing all aspects of the injured employee's care. And while there's no official referral form for non-network referrals, if you're dealing with network claims, you want to make sure that you're checking that specific network's guidelines on referrals. And remember, it's important to document any referral in the medical record. Um, the treating doctor needs to stay informed about the referral doctor findings and treatment plans. And also, the referral doctor should not refer the injured employee to another specialist without the treating doctor's approval. So again, this is going to help ensure that everything stays cohesive, and that injured employee is on the best pathway to recovery. So the consulting doctor can be brought in by the treating doctor, and the designated doctor or the Division of Workers' Compensation examine the injured employee or review their medical records. So this request is typically made to confirm the diagnosis and ensure the appropriateness of that treatment plan. Consulting doctors can assess the injured employee's medical condition, their work status, their ability to work, and also if they have any work restrictions. So while they have the authority to examine the injured employee and suggest referrals or initiate treatment, they can only do so with that treating doctor's approval. If the treating doctor approves or requests that the consulting doctor provide treatment or health care, the consulting doctor then switches roles and transitions into a referral doctor role. So they'll be taking an active role in that injured employee's healthcare management. So it's all collaborative. It's a collaborative approach. We want to make sure that that injured employee receives the most accurate and effective care possible in our system. Next, we have our designated doctor responsibilities. And designated doctors, these are our special doctors appointed by the division to provide expert opinions on disputes regarding an injured employee's medical condition. So their assessments are important. They can be procedures. So these doctors have to undergo specialized training to understand the workers' compensation system and how their role affects injured employees. To become a designated doctor, they must first complete training and testing, and then they have to apply to be included on the division's official list of designated doctors. And they're required to update their training every 2 years. And they only need to take the and pass the test once. So that certification test, they only need to do it, take it and pass it once, but that training is every 2 years. And with the recent increase in reimbursement rates for maximum medical improvement and impairment rating evaluations, becoming a designated doctor is hopefully not only more accessible, but more rewarding, because it's definitely an important role. Next, we have our required medical examination doctor responsibilities. The RME doctors are typically chosen by the insurance carrier. So in some cases, the division will choose an RME doctor to conduct an impartial evaluation of an injured employee upon request. These evaluations, most often they're sought when a dispute comes up, when the insurance carrier wants a second opinion on issues. Usually it's maximum medical improvement or an impairment rating. But again, other claim related issues could come up as well. So usually a designated doctor must conduct the initial examination before the RME doctor could be requested. If an RME is requested before a designated doctor exam has happened, the RME doctor can only assess the appropriateness of care if the request is made after uh, a designated doctor exam. Then the RME doctor, they can evaluate the MMI, impairment rating, disability, and any of those other issues. So the RME doctor does not make referrals. They're not going to be initiating treatment without the treating doctor's approval. In most cases, the RME doctor is going to be focused on evaluation rather than treatment. So, um, if they desire, the treating doctor may attend that RME exam. If the injured employee wants them to be there, they requested that they be there, and the treating doctor, they want to go and they agree, they could be there. And you can find more details about RME exams in the Texas Administrative Code 126.6. Now, our peer review or utilization review doctors, they're not going to be conducting in-person exams. So instead, they're performing detailed administrative reviews on future, current, or past treatment. So their job is going to be to evaluate the medical necessity and reasonableness of healthcare services. Uh, so they're trying to um, ensure that the care provided is appropriate and justified. The utilization review doctors appropriateness of care, and that may also occur as part of the utilization review process on pre-authorization. So they can also be asked by the insurance carriers to assess other issues not related to medical necessity. And to carry out these reviews, utilization review doctor must be licensed in Texas and then hold proper credentials to be reviewing those services or those issues. Additionally, they may be registered with the Texas Department. They must be registered with the Texas Department of Insurance as part of a recognized utilization review agency. So, for a recap, we went over definitions, basic qualifications of our healthcare providers, roles and responsibilities, and our providers in the workers' compensation system, the roles that each type of doctor plays in managing the care of the injured employee, as well as general responsibilities of both the doctors and the healthcare providers. All right, so there's going to be 5 questions. The first question is, what type of doctor manages the overall care of injured employees? The overall care? Awesome. Most of you got that right. The treating doctor is that gatekeeper, the overarching umbrella doctor for that claim, the treating doctor. Question 2, healthcare practitioners must have an active medical license to practice in their jurisdiction, or if unlicensed, be under the direction or supervision of a licensed healthcare provider. So is that true or false? And over 90% of you got that right. That is true. Definitely our healthcare practitioners must be licensed. If they're practicing in Texas, they must be licensed in Texas. Thank you. Question 3, generally the first doctor who provides healthcare to the injured employee is considered the employee's initial choice of treating doctor. So we need to be doing better on that education. It was about half and half. And this is true. Usually when there's a workers' compensation injury, the first doctor who provides that healthcare to the injured employee is going to become their treating doctor. Of course, if there's an emergency situation, the person that treated them may not be. So we'll try to do better on that one. Question 4, a referral doctor supplements the treating doctor's care and can only make referrals with the approval of the treating doctor. Yes. Is that true or false? Yes, it is true. And the majority of you got that right. Thank you so much. Referral doctor, definitely going to be communicating, seeing what the goal of the treating doctor is, and then doing what they can to supplement that plan. So, very good. Question 5. When another doctor assigns an impairment rating or certifies maximum medical improvement, they must forward the DWC Form 69 and any accompanying reports to the treating doctor for review. Excellent. Almost all of you got that right. That is true. Yes. That 69 form, that information is extremely important and must be shared with the treating doctor. Next time, we are going to be looking at registration and intake of a workers' compensation patient. We get many, many questions about this in Comp Connection. So hopefully you will attend that and learn how to get registration staff to verify employers' workers' compensation coverage, as well as reducing denials caused by incorrect payer classification. So please join us for that. And as always, we're available at Comp Connection. You can call us 1-800-252-7031, option 3, or you can reach us 24 hours a day, 7 days a week at compconnection@tdi.texas.gov, and we will answer your email as soon as we can.